Picture this, you hurry into the campus dental clinic between classes, coffee in hand, and a poster catches your eye, HPV and Oral Health. Your heart does a tiny flip. You are 18, curious, and suddenly everything private feels like a puzzle worth solving. Let me tell you a short story that ties two places we rarely put together, the dentist's chair and the inside of the vagina, and why that link should fire up your curiosity, not your shame. You meet Maya, a roommate who's majoring in biology. Over late night noodles, she says, "Did you know your mouth and your vagina both have tiny cities of microbes living inside?" You blink, tiny city. That image sticks. It turns out it's true. Both areas host communities of bacteria and other organisms. They're mostly helpful, but they can change with hormones, antibiotics, smoking, diet, and yes, contact with other bodies. Learning how these communities behave is a shortcut to staying healthy and confident. Here's the science in plain English. The mouth can carry viruses and bacteria that sometimes move to new places. Some infections that affect the genitals can also set up shop in the throat. Human papillomavirus, HPV, can show up in the mouth and later lead to changes in cells that dentists and doctors check for. Other infections can also travel. That means doctors, dentists, and you should think beyond one body part at a time. Prevention is simple and powerful. Vaccines, screenings, honest conversations with partner, and basic safety tools like condoms and dental dams reduce risk a lot. Dentistry matters in ways you might not expect. Gum disease can flare during pregnancy because hormones change your immune system. Dentists can spot unusual lumps or sores in the mouth long before you might notice them. Your mouth can tell stories about your overall health. Smoking, drinking, nutrition, and sexual exposure all leave clues. So skip the excuse of, "I'll get to it late," and make that dental appointment. A quick check can be a lifesaver. Now for the practical, curiosity-ready part. If you're exploring intimacy, be smart. Get tested, vaccinate against HPV, learn how barrier methods work, and talk with partners about boundaries and safety. Keep your oral hygiene out, avoid heavy smoking and excess alcohol, and seek medical advice if you see sores or persistent change. If you were pregnant or thinking about pregnancy, tell your dentist small changes in the mouth are normal, but they deserve attention. Finally, let your curiosity lead you. Read simple guides on the oral and vaginal microbiome, ask campus health for resources, and bring questions to your next dental visit. Science turns strange connections into clear choices. The mouth and the vagina might seem like different planets, but they whisper the same message. Respect your body, learn its language, protect it well, and enjoy discovering how fascinating you are.